Wow, so what's coming out, you guys?
Wow.
Yellow fat.
Gentle aspiration, but see, I am so meticulous to the point of being ridiculous. It's just this yellow, beautiful fat. Thank you. Wow, that fat is almost white, you guys, and it's because it is completely bloodless. I think when you put the fat graft and it looks red, it has blood in it, and of course that blood is not fat, so it's not gonna give you a buttock augmentation. So a lot of the fat resorption, yes, I understand some of the fat dies. I accept that 30 to 50% may die, but I think the great majority of the problem is that you're putting something other than fat. You're putting blood in it, and when you do that, then obviously the fat retention is not going to be the same. Thank you. I'm going to show you the difference between this area that is done. See how we're down to like a 0.5 centimeter. See here, you see? And look at the line. Can you see that line?
Yeah.
Maybe come from this side. And
Let's
compared
see the
to here,
difference.
there is no. See, there is. Look at all these spots. See, I cannot even pinch. Look at all these spots. See, but here there is absolutely no fat. You know, we're down to basically nothing. See, you see?
Yeah.
You see the difference? And look at the beautiful line of the semilunar line. We're gonna create it on the other side and in the midline. Thank you. Wow, so we're toward the end of the procedure. Can you see some definition there, you guys?
Yes.
Yeah, so you see the midline, supraumbilical line will develop like an athlete, and the semilunar lines. Can you see that?
Yes.
And it's incredible, right? Very beautiful. Thank you. Wow, look how incredible this is, huh? Look at that, huh?
Yeah.
Very, very nice, huh?
Yes.
And we just turn the patient to the side. Look at her from the side over here, Elena. This is incredible, and look how gentle I am with this implant, Beautiful, giving her a nice waist here. Thank you. Wow. We're almost toward the end of the procedure, and look at that golden, beautiful fat. That's what's gonna go into her buttocks, man. This same thing, right? Incredible. So obviously she's gonna have more fat retention. You don't even have to put a lot of fat because most of it is gonna be retained, right? We don't have that, 30 and 50% fat loss that is reported, Our patients retain most of their fat, right? At the beginning, the buttocks go down a little bit because of the inflammation the first 2 weeks, but swelling. But they retain their fat graft nicely, right? And that's the reason why, because it's pure fat. In addition, this fat, because it's been done atraumatically, doesn't have signs of damage to the fat cells. There is no oil, and so then we never had an oil cyst, for example, for that same reason. I think also the blood is irritating to the tissues, and it creates a scarring and rejection. The body rejects the blood that's outside the blood vessels where it's supposed to be, and it causes inflammation, and the blood is an irritant to the tissues, and that's what happens. So I think the blowout is also a result of that. I think a blowout is no more than the body creating a capsule around some blood, and that they recognize as foreign, and it creates like a blowout, right? A blowout is like a bump that sticks out of the buttocks, right? And I think that's probably the reason, or one of the reasons why that happens. We don't really know why those things happen, but I think that's a good explanation. The oil cyst is the same thing. The body, rejects the oil, and the oil is a sign of damage of the fat cell, because the fat cell is damaged by trauma from aggressive liposuction, and then the oil leaks out, right? And obviously that oil also is an irritant, and the body creates a capsule, much like a foreign body reaction, right? Like when you have a piece of glass and the body creates a capsule to get rid of that piece of glass and push it to the surface. In the same way, a blowout is the body trying to push out that foreign blood, and I mean foreign because it doesn't belong in the buttocks, it belongs inside the blood vessels, or oil, or both, and it tries to push it out, and it causes this encapsulated oil cyst or encapsulated spot that is dead, right? And that's probably the reason and why we don't get those complications, because the way we do it is different, right? Thank you. Wow, so what do you think about that waist?
Nice.
Incredible, huh? Look at this, huh? See? Again, basically the same thing. Can you see from back there, the pinch here? There's really not any significant exit spot here. Beautiful,
Wow.
everywhere you go. No? Can you see the pinch?
Yeah, no, incredible.
Incredible, huh? See?
Yes.
Very nice. See? Beautiful. Thank you. So I already working on this waist, but do you see the difference between this waist and the other? How this is kind of flat like that, it's not caved in.
Big difference.
Huh?
Big difference.
Big difference, right?
Right.
We're gonna make it cave in like on the other side. But this is incredible. Look at the incredible output of fat, right? This is just incredible, right?
Yes.
And I'm very gentle with the tissues, right? I just hold on this micro basically with two hands and do gentle movements here, right? Very gentle movements on my hands. So we keep it safe also. I mean, you know, when you drive, you crash and stuff, and bad things happen when you go very fast, right? I think it's no different here. If you go too fast, you may go into an area you don't want to go to. Like, for example, inside the belly, into the intra-abdominal cavity, or inside the thorax, into the intrathoracic cavity, and cause some serious injury and, you know, disability and even death, right? If you do that. And that's something we've never done, thanks to God. But I think part of it also is that it's more difficult to do that because usually that is the result of unintended strokes, that when you go very fast, you may lose your spatial awareness, right? The awareness of where your space is, right? And you may go inside an area that you don't want to go, and that's something that never happened to us, and thanks to God, let's hope that it never happens. But, you know, it's more difficult to make a mistake and to go in the wrong area if you're doing it in this very controlled manner, right? Let the instrument do its job. Thank you. Alright, so this is the fat that we're putting into her buttocks. Look how flapless this is and how beautiful. We're doing it under ultrasound guidance to make sure that we put it in the right space, right? Under the skin, over the muscle, where it's safe. This is the way we like to do it here at the Cosmetic Surgical Center of Costa Rica. Thank you.
Alright, so we're doing ultrasound guided gluteal fat transfer. This is Dr. Patino's cannula right here. He's going to wiggle it for us. See it wiggling. Up here we have the superficial gluteal fascia, and down here we have the deep gluteal fascia and the striated muscle. So this is the area where he won't be putting any fat. Right here, from here to there, is where he will be putting fat. That's the skin.
Right, and you see the tip of that cannula right there?
Yep.
So I'm going to go ahead and give it a bolus. Look at the tip of the cannula, and you're going to see a cloud of fat. It's going to look like a gray cloud right now. Watch it.
Awesome. So you see how we have the gray fat coming in right here. We have the deep gluteal fascia getting pushed down as fat enters this space.
Thank you.
Thank you. Alright, so we're on the other side. Here's Dr. Patino's cannula. He's going to wiggle it. See it wiggling. This is the superficial gluteal fascia, that's your skin, and this is the deep gluteal fascia. So you can see there's not a lot of space right now, but the doctor's going to be putting fat in, and we're going to see how this deep gluteal fascia is going to get pushed down.
Where's the striated muscle?
This way.
We don't want to go there, right?
No.
Very good. So now we're going to start, and you're going to see the cloud of fat again.
Yeah. There we go. So here we have that cloud of fat right there. We have the nuclear fascia getting pushed down as fat is entering this space.
Thank you.